Pushing down on me, pressing down on you. No man has fallen under pressure. The crazy building down, streets are very true. But people on streets,
Today we're going to be talking about pressure injuries. A pressure injury is an area of the skin or underlying tissue of the skin that is damaged. You may also hear these injuries referred to as bed sores, or pressure ulcers. These types of injuries are most common on bony prominences of the body, such as the sacrum and the heels. Pressure injuries cause a significant amount of pain and discomfort for the patient. This is exactly why it's very important to prevent them if possible. Pressure injuries are caused from intense or prolonged pressure on the body or pressure that is accompanied by a shear. A shear is when skin is sticking to something that is moving in the opposite direction of the body movement, causing a skin tear. Other things to take into consideration when it comes to pressure injuries is the amount of time that pressure is put on the area, how much pressure was on that area, and whether or not there was a buildup of moisture. Speaking of prevention, let's talk about a few conditions that might cause a pressure injury. Some risk factors include advanced age, anemia, cognitive impairment, critical illness, diabetes, friction, hip fracture, immobility, incontinence, long surgical procedures, major trauma, malnourishment, musculoskeletal problems, neurological problems, peripheral vascular disease, and spinal cord injuries. Of those, the most common risk factors are immobility, incontinence, and malnourishment. It is of utmost importance to make sure you are doing a full head-to-toe assessment on your client each interaction to notice new or worsening pressure injuries. A stage 1 pressure ulcer is intact skin with non-blanchable redness of a localized area, usually over a bony prominence. Blanchable redness or changes in sensation, temperature, or firmness may also cause visual changes. This stage may also be hard to detect in people with dark skin tones. A stage 2 pressure ulcer is a blister or partial thickness loss of skin with exposed dermis. The wound bed is visible, pink or red, and moist. There is no slough, eschar, or granulation tissue. A stage 3 pressure ulcer is tissue loss in which subcutaneous fat may be visible. Granulation tissue and rolled wound edges are often present. Slough and/or eschar may also be visible in this stage. The depth of the tissue damage may vary depending on anatomic location and areas of significant adipose tissue. Lastly, undermining and tunneling may also occur. A stage 4 pressure ulcer is a full-thickness skin and tissue loss with involvement of muscle, tendon, ligament, cartilage, or bone. Slough and/or eschar may be visible at this stage. This stage often includes undermining and/or tunneling. Depth for this stage also varies by anatomical location. A unstageable pressure injury is full-thickness skin and tissue loss in which the extent of the injury cannot be determined because the base of the injury is covered in slough and eschar. A stage 3 or stage 4 pressure injury is present after removing the slough and eschar. Stageable eschar on the heel or ischemic limb should not be softened or removed. A deep tissue pressure injury is intact or non-intact skin with a localized area of persistent, non-blanchable, deep red, maroon, or purple discoloration, or epidermal separation revealing a dark wound bed or blood-filled blister. Pain and temperature changes often precede skin color changes. This may be hard to detect in people with darker skin. It also could evolve rapidly to reveal the actual extent of the tissue damage or may resolve without tissue damage. Visible necrotic tissue, subcutaneous tissue, granulation tissue, fascia, muscle, or other underlying structures indicates a full thickness pressure injury. Now, let's review.
Under pressure, the boys are building down, steps are fairly into, with steeper streets. Eat it up, that's okay. That's the terror of knowing what this world is about. Watching some good friends scream.
Now let's look at a real-life example.
Hello, my name is Micah. I'll be your nurse today. So, what brings you in today?
Well, I had a fall at home and the ambulance came and they said something was on my butt and now I'm here and I don't know what they said, but it hurts.
Okay, I'll check that out today. Do you live alone or do you live with someone? Someone take care of you at home?
Yeah, my daughter, she's my caregiver.
Okay, and is she here with you today?
She be coming in a little bit.
Okay, alright. Well, I'm just gonna take some vitals and do a skin assessment and then we'll go on from there, okay? Hey, Caitlin, can you come help me in this room real fast?
Hi, my name's Caitlin. I'm gonna help her roll you today, okay? We're gonna roll you on your side so we can look at your bottom.
We
Alright.
gotta uncover ya. 1, 2, 3.
Mom, what are you doing here?
Oh, Sarah Lou, I had a fall at the house and I had to call the paramedics and they sent me here.
You're fine.
Are you,
That's what I told them.
are you the daughter
Yes.
and you've been taking care of her?
Yeah, I take care of her.
Do you know about how long she's been incontinent for? Is this relatively new?
Incontinent?
Yes.
You got it.
I don't think she is.
Okay.
She's in her chair at home and she does fine.
Does she ever get up and move around? She's got quite a bit of bed sores
She
back
says
there.
she does.
She says she does. Do you help her with any of those?
Well, I mean, she says she's fine doing those things. I don't think I need to help her.
Okay.
I mean,
How long has your bottom been hurting you?
I mean,
Well, I really feel it when I get up out of my chair at nighttime to go to my bed, and then during the day it just feels pretty numb.
How often are you getting out of your chair throughout the day?
Just about maybe twice to use the bathroom and go to bed
Do you sleep in the chair
during the day.
during the day? Do you sleep
yeah,
in
she sleeps all the time. I can't get her to get up and do a whole lot.
Well, we're gonna get some maybe patches back here for you to help alleviate some of that
Is
pain.
there something back there?
What kind of patches?
Well, it's a pretty decent bed sore. That's back here.
So like a pain patch?
No, not anything for pain. It's gonna be like to keep the wound covered so it doesn't get infection. Yes.
She's got a couple pretty bad wounds back here just from sitting on her bottom for so long.
Mom, I told
Sarah, do
you.
you
need
know about this?
No, I told you you need to get up and move around more.
Do-
I don't know what to do with
do you
her.
take any medication at
She's so
home?
lazy at home.
Oh.
Do you know any medication she takes out?
Yeah, she takes something I think for her blood pressure. That water pill. Don't you take something for your thyroid too, Mom? I don't know.
I don't know. They give me a whole list, but I only take like 2 in the
Yeah.
morning because the rest of them I don't need those.
They gave her pain meds, but we don't give them to her. She
I-
don't need them.
I just
We
let
I
Sarah handle all that.
take care of that and put them away.
Okay. Alright.
Okay, well, we'll get you covered up and we're gonna doctor your bottom here in a little bit. That way it'll help you heal and maybe you won't have as much pain, okay? So we'll roll you back over for now.
When treating a pressure injury, it's important to remember that once a pressure injury forms, it is very important to treat it as soon as possible to prevent infections or further damage to the tissue. The main treatments for pressure injuries include frequent wound care, debridement, use of tools and techniques that reduce pressure on the bony prominence, improved nutrition, antibiotics, wound drains, and surgical repair. Here's a little helpful tip. Some people may think that massaging a pressure injury would be a great way to provide blood flow and help it heal. However, this is wrong. Massaging a pressure injury is contraindicated because it can actually cause more tissue damage and skin breakdown. If left untreated, pressure injuries can cause a plethora of life-altering issues. According to the Mayo Clinic, some of these issues include nerve damage and chronic pain, sepsis, cellulitis, bone and joint infections, loss of mobility, limb amputation, cancer, and mental health issues.
So I'm going to do some wound care for you. I'm going to spray my wound cleanser. I'm going to clean the wound bed. I'm going to measure so I know I've got some tunneling here. I'm going to insert it. And we're going to say 4 centimeters. They're at like 7 o'clock. And then I've got some undermining under here. Roughly like 2 centimeters from like 10 to 2 o'clock. Okay, everything's cleaned. So I'm going to take my packing and I'm going to pack this wound, tightly packing it. Leaving enough of a tail so that I can remove it when it's time. And then, depending on this wound, I would probably get this wet and again pack it up in there. And then, depending on the doctor's orders, I could apply ointments as needed or other wound dressings for this purpose. I'm going to just cover it with an ABD. I'm not doing that at home.
You can't even put a Band-Aid on it?
Surely you can put it in.
I can pack it, probably.
But how am I supposed to go stay with Steve if I've got to do this?
So with her types of wounds, it's really important that you are keeping them clean and dry, and that we're moving her about every 2 hours to prevent it from getting worse. Because it can
Every 2 hours?
Yes.
I have my own life.
So there's some options that you could do. Maybe putting her in a home.
A home?
Yes.
Maybe I can go check some
Or getting
places
some
out.
aids. Yeah, getting some aids. I can get a social worker in here to talk to you if you like.
I mean, what's this going to cost? I mean,
They will be able to tell you all the options.
Sarah, what about my check?
But Mom, we need that check at home.
Hello, this is Nurse Micah. I have a patient that will need a consult in room A5. Is there any way you can make it down here? All right, thank you.
Hopeful, yes I am hopeful for today. Take this music and use it. Let it take you away and be hopeful, hopeful, and he'll make a way. I know it ain't easy, but that's okay, 'cause we hopeful.
Wow, what a powerful story. To prevent the formation of pressure injuries altogether, here are some helpful tips. Regular inspection of the skin on bony prominences or anywhere else that may be under constant pressure will prevent pressure injuries. Make sure the skin is clean, dry, and use moisture barriers. reposition frequently, transfer properly using techniques that reduce skin breakdown, encourage the patient to be mobile when possible, educate on the importance of proper nutrition, and use other prevention tools like weight loss. As for skincare goes, keep it clean and dry, protect it, and inspect it daily. As far as patient and caregiver education goes, identify and explain risk factors and cause of pressure injuries, teach the caregiver techniques for incontinence, demonstrate correct positioning to decrease risk for skin breakdown, teach the caregiver to reposition bed-bound patients every 2 hours and wheelchair-bound patients every hour, review available resources, teach the patient or caregiver to place clean dressings over sterile dressings using no-touch technique, teach the patient or caregiver to inspect skin daily, and review the importance of good nutrition. Now let's watch some do's and don'ts.
Hello, how are you feeling today?
My back is kind of hurting, like down towards my butt.
Okay, well, I have to go see another patient, so I'll be back as soon as I can.
Okay.
Hello, how are you feeling today?
My back is still hurting.
Alright, well, I guess I'll get you moving, alright? So we're
Okay.
gonna change position.
Okay.
Hi, I'm gonna be your nurse today. How are you feeling?
My butt is kind of hurting.
Oh, okay. How about I'll take a look at it. We'll get a pillow under you, make sure that, there's not any bed sores forming, make sure that you're all good.
Okay.
Alright, roll back over. And then, is that comfortable for you?
Yeah.
Hello, how are you feeling today?
I think I had an accident.
Oh, well, do you really need my help for that?
Yeah.
Well, I guess I'll go get some supplies and I will be back.
Hi, how are you feeling?
I think I had an accident.
Oh, we can get that taken care of for you.
That's okay.
No, we don't want you sitting there with a wet bed. That could cause a pressure injury. So we'll take care of that really fast for you. I'm just gonna go grab some supplies.
Okay.
Hello, how are you doing today?
I'm a little hungry.
Oh, well, lunch is coming around at 2 o'clock. Can't you wait?
Can I get something?
I have some snack cakes.
I love snack cakes.
Hi, how are you feeling?
I'm kind of hungry.
Well, I can get you the lunch menu. We have some really good high protein meals that might help you heal. That concludes our presentation over pressure injuries. Now you can prevent and treat.
Thanks for watching, and don't forget, always turn your patients.
This magic moment.
She lives there.
Okay. And what do you got going on today? What's been hurting you?
Wait, what am I here? Do we have the butt ready? Okay.
Yes.
Have you been taking care of her?
Yeah, I take care of her at home.
How long has she been at cotton for? Do you know? Is this like a relatively new thing?
Oh, this is raising.
Well, that's good for now. Rose, offer you maybe like a fat cake.
Fat cake? What?
Okay. Oh no, you're falling off the bed. Hannah, you can't just leave it on.
Bye, guys.